Hello, everybody. Thank you so much for joining us today. I am here with the owner and founder of Age and Family Services, Cheryl Theriault. Cheryl, are you there?
I am. How are you?
I am doing fine. I hope you are.
Yes, thank you.
Wonderful, wonderful. Well, we're just gonna, dab right in and let the people know what it is that they actually come here for, to hear about you guys and what it is that you do. I think that this is an incredible service that you all provide, and a lot of people don't know that you're there. So I appreciate you taking the time to do this interview with us on today.
Thank you.
All right. Can you provide me with a description of your business?
Yes, Aging Family Services is a elder care consulting business. Nationally, we're called Professional Geriatric Care Managers, but basically we work with older adults and their families and people who are experiencing challenges of disability in their lives. And these aging and disability bring challenges into people's lives. They have to make decisions about where to go to get services, about where they're going to live, and they don't know where to look for these resources. So geriatric care managers serve as a guide. We offer information about their options, and we also offer peace of mind to people so that they feel like they have good information when it's time to make these important decisions.
Wow, that's really good. Just listening to what you were just talking about, and again, I said earlier that this is a service, and I'm hearing so many different touch points in it, identifying the needs of people and so forth. But what exactly actually introduced you to the business? How did you get started? Why this?
I realized probably over 20 years ago that there were people out there experiencing these issues in their lives, and my mother was one of them. She was trying to make care arrangements for her mother, and I had worked for the county social services and was able to help her figure out what her options were. Then I ran into someone in my neighborhood facing a situation with her mother, and I realized that these families' lives were being turned upside down with an event that happened, and they were making important decisions, but that they didn't have any information to make a good informed decision. And I said, well, these people need help, and I'll be the one to help them. At that time, I did not know that there were people across the country doing this kind of work and called themselves geriatric care managers. I thought that I had just come up with a good idea for trying to help people.
That's awesome. That is really awesome. It speaks to the heart, your heart. And it lets me know, everyone who's listening, everyone who's watching, that to connect with Age and Family Services means that you're connecting with someone in a group of people who really have a desire about what it is that they're doing. So I think that is incredible. I wanted to find out what exactly geriatric care management is. I know you spoke a little bit about some of the things that you do, but when we hear geriatric care management, what exactly does that mean?
We are health and human service professionals, the geriatric care managers around the country, and we take a holistic and person-centered approach to working with these families. Each person's situation is totally unique, and so we begin with an assessment, and that is visiting the older or disabled adult in their home and trying to learn about them. We call it a biopsychosocial assessment. So it's very comprehensive. We want to know about their social network. We want to know about their functional abilities. We need to know whether they're cognitively impaired, whether they have some physical limitations, what their medical situation is. We want to know how they're doing emotionally. We evaluate their legal planning. We want to know that they if they have not made advance directives such as a power of attorney and a healthcare power of attorney, we like to inform people of the importance of doing those things. And the final piece is financial. When we're recommending resources, we want to make sure that what we recommend is appropriate, and we help people understand how things get paid for, whether there's insurance that would cover it, whether they would be paying for these services privately, because we want to refer them appropriately based on what their needs are and what their financial situation is. Then we follow that with interviews of other significant others, family members, maybe medical providers, trying to get a complete picture of the family's situation. We take a tour of the home to see if there are any safety issues that we have concerns about or any modifications that might need to be made, and we follow it all up with a written care report, and we refer people to resources in the community specifically to meet the need that has been identified. So we will give names of companies and telephone numbers and help people sort through the system by knowing exactly who to call for what.
Wow, that is incredible. It really is. I'm reflecting on a period in my life. At the age of 29, I actually was a widow. I lost my first husband to brain cancer. Oh. And I remember, you know, he wasn't elderly. He was 30 years old at the time that he was diagnosed, and he passed away when he was 31. So he wasn't elderly, but many of the things that you're speaking about, I needed. But you don't know where to go. And I remember my family just kind of pulling together, raising money, and hiring someone to even just come into my home to care for him so that I could continue to work. So the things that you're talking about, the services that you're actually sharing with us on today are things that are so needed, but we don't always know where to go. Now, you've already pretty much answered many of the questions. There was two other questions that I actually wanted to ask you today, but you pretty much touched them when you talked about the things that you do. But I wanted to give you an opportunity. Is there anything else that you would like to share with our viewers? Is there anything else that you would like to let them know that you guys do as geriatric care managers?
Well, first of all, I'm so sorry for your loss, and I do appreciate that part of the dilemma that people face is the emotional aspect of dealing with disability or aging, and that just makes it that much more complicated to try to figure out what to do. One of the things that we do is with this care report, that can be the final product for a family. We just turn it over to them and they can implement the services, put them in place. There are families, however, who live at a distance and their loved ones live in this area who ask us to oversee the care on an ongoing basis. And we will drop in, make home visits unannounced to oversee the care, to monitor how things are going. We stay in touch with the out-of-area relatives. We can go to medical appointments with these clients and make sure that if there are labs that are ordered, that those take place. If there are medication changes, we want to make sure that that takes place as ordered by the physician. And we are here in case of an emergency so that we can step in and let the relative at a distance know whether there's something important that they need to get down here for, or if it's something pretty simple that can be handled and the loved one return home. And Aging Family Services has started doing guardianship work. We've been doing that since 1999, and there are a number of folks who have not put advanced care in place, such as a healthcare power of attorney. And if they become incapacitated, someone needs to have the legal authority to make medical decisions for them, with them, and guardianship is the only alternative after someone has become incapacitated, but has not already made arrangements for someone to step in and take over their affairs. So we do that as well.
Wonderful. You know, I had the opportunity to read your blog, and I saw where, do they call it like an elder law attorney, had
Yeah.
actually written about your actual profession. And it really impressed upon me the importance of what you guys do and how you guys are really a part of the team, if you will, when it comes down to families getting together, trying to make decisions about their loved ones and what it is they want to do next. So I want to encourage the viewers, too, to make sure they take a look at your page and take a look at your blog, because you have a wealth of information up there just to share with us as well. So thank you for that. Cheryl, I just wanted to take the time to let you know that I really do appreciate you taking the time out to talk with us on today. It has truly been a pleasure, but I want to give our viewers an opportunity to touch base with you on their own if they need to. What's the best way to get in touch with you?
Email is perfectly fine, and that is Cheryl, CHERYL, at agingfamilyservices.com, and the telephone number is 919-781-5979, and I'm at extension 101.
Extension 101. Excellent. So if you want more information about geriatric care management, specifically working with aging family services, please do not hesitate to give Cheryl a call at 919-781-5979. Her email address we also have shown and listed right here for you to see. We thank you so much again for joining us, Cheryl. We thank you so much for taking the time to spend with us on today. To our viewers, thank you as well. And Ms. Cheryl, it's been a pleasure.
Thank you so much, and you have a good afternoon.
All right. Bye-bye.
Bye.